Good evening, everyone in the audience. My name is Dr. Alan Marble. I'm the chair of the Medical History Society of Nova Scotia, and I'm here tonight to talk to you about the history of how the poor and the harmless insane were accommodated and cared for in Nova Scotia over a period of about 200 years. The word harmless insane appears in the title of my talk, and I'll explain what that means later. Prior to 1601, there was no law that had to do with the care of the poor or the treatment of the poor or anything to do with the poor in England. However, in 1601, it was decided that it was necessary to have a law because the poor were wandering all over England within the cities, particularly in the city of London, and it became very, very difficult for the residents of those cities and towns in England. So the English government enacted a poor law, 1601. Now, because of course the settlers who came to Halifax and to Nova Scotia, in particular to Halifax, were from England at the beginning, at least, Nova Scotia adopted the poor law too, the English poor law, in 1758, and it lasted until 1958, 200 years, just by coincidence, 200 years. And so I'd like to describe it first because it sort of forms the beginning of how we were dealing with the poor in Nova Scotia. Poor districts were established in every county of Nova Scotia at the time. And prior to 1879, overseers of the poor were appointed by the Court of Sessions in each poor district. The overseers of the poor managed the poor tax collected from all the residents. Anyone who owned property, in other words, had to pay a poor tax, which was allocated by the Court of Sessions for the support of the poor. The funds were used to provide for the poor either by private contract or by auctioning them off to the lowest bidder. Now, I'm obviously going to have to explain that last sentence, auctioning them off to the lowest bidder. The only document that I've been able to find in the Nova Scotia archives that deals with this period prior to 1879 is a document dealing with contracting and auctioning off the poor, and that the year that that document appeared was 1851. And the source of where you can see that document, and I'm sure quite a lot of people would like to go and look at it, it's well hidden, but it's there for the public to look at, is the Nova Scotia Archives, NSA, RG25, Series C, Volume 3. So if you go to the Public Archives Nova Scotia and ask for that document, you'll get a very thick file, over 100 pages. And what I've done here is summarize what's in those 100 pages. The files are submissions from about 40 parts of Nova Scotia, from Amherst down to Yarmouth. And they list not only the total number of poor that they were looking after by private contractor auctioning, also the average age of the individuals, whether they were under private contract or being auctioned off, and also how much it cost each location during the year to look after the poor, and listed in pounds. Now, at that time, a pound was worth about $4, so you can get an idea of how much the location, the area was paying for their poor. You'll notice if you look at the list under disposed of by, That's not my word, by the way, disposed of. It's the word that was in the papers, the various documents that are in the file in 1851. And you'll notice about half of the towns and villages were using auctioning off. Most of them were using contracting. Now, the explanation of the auctioning off is that the overseers of the poor had received a certain amount of money from the Court of Sessions, and they had to try to deal and care for all their poor in their area with that money because they didn't have any more. That was it. So obviously, when they tried to look after, say, 20 poor people, the idea was to try to get local citizens, residents, to pay to look after the poor person, or if it's public auction, the same thing. Anyone could bid on the poor people. So in every September, if there was a public auction, all the poor people would be herded together in the town center, and there would be a bidding of who would take them. And obviously, the overseers who were sitting back were trying to get the lowest bid because they were trying to make sure they didn't have to pay more than the money they had to look after these poor people. So every year this happened. So that meant that people who were in the category of being poor would end up possibly living in a different location every year with some farmer or some workman or somewhere. And it made it very difficult for their lives, of course. Their lives were very difficult anyway. Now, in Halifax, it was different because Halifax had a poorhouse very early, 1758. And what you're looking at now is the location of where the poorhouse was. It was actually in the workhouse. Now, the workhouse was actually built to house petty criminals. But because there was no poorhouse and there were lots of poor people in Halifax at the time, they put the poor people in the workhouse as well. So here we have then the workhouse consisting of petty criminals, also with paupers, and you can imagine it wouldn't be a very friendly place to be. That was in 1762. 70 years later, or 60 years later, Halifax had its own poorhouse. There was also a house of correction, which had been the workhouse, just a different name. That poorhouse that you see at the corner of Spring Garden Road and Queen was built for about 250 paupers. However, usually in the wintertime, there were 300 to 400 paupers, poor people, in that poorhouse. So it was a very, very unhealthy place to be. So now I'm sure you would like to know what type of people were in the poorhouse. And this applies not only to the Halifax poorhouse, but to all the poorhouses I'm going to talk about later, including the one at East Hants. The majority of the people in the Halifax poorhouse during the period of 1802 to 1811, I happened to find that document in the Nova Scotia archives, and it's very revealing. It does indicate that most of the people in the poorhouse were there for medical reasons, for health reasons, due to illnesses, diseases, and accidents. Accidents were very common at that time because there were no safety rules at all. So a lot of people were in the poorhouse due to syphilis and gonorrhea, and a lot were in due to frozen feet and hands and so on, because a lot of people froze to death while they were outside before they ever get into the poorhouse. There were also deranged idiots and insane and lunatics in the poorhouse. there was consumptive people, people with consumption, there was people with dropsy, people with that were paralyzed. It just goes on and on and on. It's very, very sad to read it, but these type of people were in the poorhouse, and because there was no hospital in Halifax at the time. Halifax didn't get a public hospital until 1867. We're talking about the first decade of the 1800s, so you can see that it was quite amazing the type of individuals that were in there. Now, the other category of people that were in the poorhouse, of course, were the paupers. And so we have sort of 109 paupers. We also have vagrants. We have old age people like myself. We have intemperate people who were drunk, possibly. We have pregnant women, quite a few actually. We have a lot of babies, a lot of children, and a lot of orphans, of course. So it was a combination of people that found life very, very difficult for various reasons, and it must have been a shambles to actually live in there, especially in winter, because it was overcrowded by a great deal. Now, I also wanted to give you an idea of the number of people in a poorhouse, say in Halifax, which is what we're looking at right now. Typically, during the year, there were about 800 people in the poorhouse. Fortunately, they weren't there all at one time. And you can see with this graph that some of the years, there's no information whatsoever. But approximately from about 1820 up to 1866 or so, there's records in the archives, although they're very difficult to find, but I put them all together over the years, and you have 800 people going in and out of the archives during the year. Most of the people were men, that's in the red line. The yellow line is the number of women, and the real sad part is the number of children that were in the poorhouse during the year. 200 children in the poorhouse during the year, which it must have been awful for them to have to put up with people who were from all types of reasons of why they were in the poorhouse. The poorhouse was moved over to where the IWK hospital is now, on the corner of Roby and South Street. And you can see it in this diagram that was drawn in 1879. The poorhouse and asylum, they are a very large building. And you'll notice on the same piece of property is the city hospital, which eventually became the BG hospital. And it was there until it burned. And now we're going to find out that a lot of poorhouses burned down. This fire occurred in 1882 in November, and there were 31 people burned to death. Mind you, there were 343 inmates in the poorhouse at the time. So it was a 4-story building, so it was very difficult to get people out. The new building, which became known as the City Home, which was built in 1886 and was only closed in 1971, is shown in this figure here. And as you can see, it's a gigantic building, probably the largest building in Halifax at the time. And it housed 400 or 500 people right on the corner of Roby Street and South. Now we'll go to the county now, into the counties, a rural part of Nova Scotia. Up until 1879, we had the approach of using contracts and auctioning off poor people. Back in 1879, they passed an act which created the counties and the municipalities in Nova Scotia. and they authorized each municipality to establish a poorhouse. A few years later, in 1886, another act dealt with lunatic asylums, and the counties were then authorized to house their harmless insane in the poorhouses rather than at Mount Hope. Now, let me explain that. Mount Hope, which is called the Nova Scotia Hospital now, it actually held all the mentally ill people in Nova Scotia. And by 1886, the number had increased to over 500 within the Nova Scotia Hospital or within Mount Hope. And the superintendent said it was impossible to deal with that number, so he finally convinced the provincial government that they had to do something with these insane people. So he divided the insane people into the harmless insane. That meant the insane who were no danger to anyone else, including themselves. Most of them had dementia, I suspect, and other mental illnesses that meant they weren't violent. And the other category were violent insane, which he kept at the Nova Scotia Hospital. And so we had that big division taking place in 1886. However, that meant that the county's insane, which had been in the Nova Scotia Hospital, were now transferred to their poorhouse. Well, you can imagine that must have been a very difficult situation because the municipal authorities, of course, probably didn't really want to mix the insane with the sane. However, that usually happened because they couldn't afford to build another building in most cases. And so in most cases, what they did is they partitioned the building into two halves. And the paupers were in one half and the harmless insane were in the other half. Now, this was very beneficial to the counties, however, even though they had trouble trying to decide what to do with all these harmless insane people. This shows from the Nova Scotia Archives again, it shows for each of the municipal units in Nova Scotia the fact that in 1886, when that bill was passed, a lot of them owed a tremendous amount of money to the Nova Scotia Hospital. In fact, the cumulative amount of money that the municipalities owed to the Nova Scotia Hospital was $69,000. Once the harmless insane were moved from the Nova Scotia Hospital to the county poorhouses by 1899, the amount that was owed by the counties went way down to $10,000. So that it was beneficial. In other words, what was happening, it turned out that it was cheaper to look after an insane person in a county poorhouse than it was to look after the same person in the Nova Scotia Hospital. The Nova Scotia Hospital charged a great deal, $100 a year, for looking after insane from the counties. And so that really relieved the municipalities of a large amount of money. If you look at this map of Nova Scotia, you'll see the poorhouses that existed in Nova Scotia, the blue dots, in 1892. So you'll notice that after the Municipal Act was passed creating poorhouses in the province, that practically all the counties built or bought a building for a poorhouse. Now you'll notice that the only one in Hants County, of course, is near Windsor. The one at East Hants hadn't been built yet. It was only opened in 1895, so it doesn't get a blue dot. But you'll notice some of the counties, like Kings County, which is next to Hants County, it is 3 poorhouses, one in Aylesford, one in Cornwallis, and one in Horton. And if you look around the province, you'll notice there's one in Sydney, one in Inverness, one in Antigonish, one in Pictou, and so on and so on and so on. In other words, there were a total of 16 around the province. So once the act was passed in 1879, counties started to build poorhouses. I also put on here the number of hospitals in Nova Scotia in 1892. You'll notice there's no hospital outside of Halifax and Dartmouth. The only hospitals in Nova Scotia in 1892 were the VG Hospital, the Halifax Infirmary, and the Nova Scotia Hospital. So, and in fact, one reason why Nova Scotia was so slow in establishing hospitals, particularly by the counties, was because they couldn't afford to. They could afford to build a poorhouse, and they felt that that had a higher priority than building a hospital. So they couldn't afford to build both of them, so they built the poorhouse. That meant that a lot of the poorhouses acted as hospitals. They had their own medical doctor, and the people would go to the poorhouse for medical treatment, even though they weren't necessarily a resident in the poorhouse. By 1932, 40 years later, the number of poorhouses, those blue dots, have increased dramatically. We're up to 25 now. And you'll notice that there is one now at East Hants. And there's also a hospital now at Windsor, the Besant Hospital. The number of hospitals have also increased dramatically, up to 31, so that we get a lot of care institutions. They call them charitable institutions throughout Nova Scotia by 1932. I'd like to show you some of these hospitals, or some of these poorhouses, which also served as asylums. The word asylum has always, ever since time immemorial, been a word to cover the care of mentally ill people, although it also covers paupers as well. So it's a very common term that has been with us from time immemorial. The county of Annapolis, one of the most attractive and largest facilities in the whole province outside Halifax, was built by the residents of Annapolis County. And they just got together and they just built the building. And you can see how immense it is. And there were 52 paupers in it in 1910. And I want to show you some others because it gives you an idea how communities did react to the necessity of having a poorhouse. Now, Bridgetown, after about 12 years after they built their poorhouse, said, well, we need a separate building for an asylum for our mentally ill. So they built this brick building, which again is quite ornate and quite immense. The largest building in Annapolis County at the time for their mentally ill. It only closed, until 1987. I remember going there to visit a number of times, people who were in there, and I used to go in and interview people who were in the poorhouse, in the asylum, and they allowed me to go in because they understood that I didn't have any other intention other than to try to understand what was going on and how they were treated and so on and so on and so on. They had 52 inmates in 1910. Now, down in Yarmouth, Yarmouth established a poorhouse very early, 1870, and it's again a very ornate structure, it's really quite amazing that the citizens would build something like this, but they felt that they really had to look after their poor. And outside of Digby, in a place called Marshalltown, we have the Digby Poor Farm and Asylum. You'll notice the ladder up the front. Most of the poor houses didn't have proper fire escapes. And that ladder is there so that people in the upper story could somehow get to the ladder in the case of fire and crawl down. That would be extremely difficult to do at night, I would think. But they didn't, that's all they had for a fire escape. So it was really, really dangerous business. And this is in Waterville, Kings County, the poorhouse, and 56 inmates. Here's the asylum in Waterville, 58 inmates, 1927. This is the West Hants Home for the Poor near Newport. It's part of Newport, along the Meander River. And I went there one time to try to find it. Of course, it no longer was there. But I did notice across the street from it was a little cemetery. And unfortunately, the cemetery was simply a number of concrete posts with numbers on the posts, not names, but numbers. I eventually found out what the number stood for by going to the West Hants Historical Society. They have a list that gives you the name corresponding to the number. So there are some records for these various poorhouses, but they're very, very difficult to find. This is the one in Truro, which is a magnificent facility. Look at that, 3 stories and a major, major farm. I had a relative who was the cook in that house, in that poorhouse, so I got a chance to go inside myself and see it as a young boy. And I always seemed to have had an interest in anything to do with history. And, it's unusual for a young 15 or 16-year-old to go into a poorhouse to try to find out how they live. But that was the case with me. I just thought it was something that I really enjoyed. And Pictou County at Riverton, they have this a large poorhouse, 90 inmates in 1910. And this is their asylum at Riverton, an immense structure. Antigonish poorhouse in a place called near Antigonish, but it burned down in 1947. I'm going to talk about it again later because when it burned down, the 50 inmates, or the number there in 47, they were transferred to the East Hants Municipal Home, and fortunately, East Hants could accommodate them because you can imagine nobody was burned in this fire, thank goodness. There were many, many fires. This is a Shelburne Poor Farm and Asylum. Lunenburg was major, a large place, 81 inmates in 1929. They had both a poor farm and an asylum. It's just south of Bridgewater on the Lahey River. This is Richmond County Poorhouse in St. Peter's, and it burned again in 1920, and the residents of it, or the inmates, were moved to East Hants, and I'll talk about that a little later. The Cape Breton Asylum, large place, 100 inmates in 1910. And look at the Inverness one at Mabou. Just unbelievable, 180 inmates. It did burn down, and there were 2 people who burned to death, but an immense structure. So it shows you that the people in the counties, in the municipalities, really felt that they were required by the ethics of it to look after their poor and mentally challenged. Now, in 1887, Nova Scotia government fortunately decided that they should have an inspector of humane institutions, which included poorhouses and hospitals. The inspector of humane institutions, and the first inspector was a retired doctor, Dr. Alexander Page of Truro. And you can imagine his job every year was to visit every poorhouse in Nova Scotia. And he did that with his wagon and horse. I expect once in a while he would take a train, but in his reports, he talks about mainly using his horse and wagon. Well, that would be a very difficult thing to do in 1887 when the roads were very, very poor in Nova Scotia. But he traveled all over the province, and fortunately, he wrote a report about every poorhouse that he visited. And that is a gold mine of information to tell you about the conditions in poorhouses. So Dr. Page wrote his first report in 1887, but he was followed by 4 other inspectors, all medical doctors, and 2 of them were formerly superintendents of Nova Scotia Hospital. The inspectors were required to make an annual inspection of each poorhouse. Their visit was unannounced, and they were required to take or partake in a meal at the poorhouse or the asylum. In other words, they would arrive unexpected, and they would walk in, and they were asked, or they were required by the government to sit down and have a meal with the paupers and the mentally ill, which really is quite an interesting situation, because they always commented on the meal that they received. And I remember reading one report, which gave me a chuckle. The inspector said, that was a better meal than I can get at home, which I'm sure his wife never read because she would be rather upset. But that's the comment he made. I was really surprised. Now, the inspector was required to report on the number of paupers and harmless insane, the number of males, the number of females, number of children, the water supply, the fire escapes, the beds, cleanliness, lighting, heating, separation of males and females, separation of sane and insane, diet, ventilation, toilet facilities, bathing facilities, recreational space, community involvement, religious services, medical attendance, evidence of mean treatment, education of the children, staff training, and productivity of the farm. And the inspector would comment on all of these items with respect to each poorhouse. Now, the results were varied greatly. This is a summary of the living conditions at poorhouses and asylums from the information provided by the inspectors. They generally found that the cleanliness, food, and water supply were adequate, and in many of the poorhouses, not all, but in most. Most poorhouses and asylums were lighted with oil lamps, which was a dangerous thing, but there was no other alternative at that time other than candles. Toilet facilities were outdoors, and bathing facilities were inadequate. Now, I want you to remember these types of conditions, because I'm going to very soon talk about the conditions at the East Hants Memorial Home, and so we can make a comparison here. Poorhouses and asylums were poorly ventilated and presented offensive odors. You can imagine, especially in the wintertime, with all those people there, sometimes bathing once a week, and some of them sick, that it would be a difficult place to be living. Only a few of the poorhouses and asylums had adequate fire escapes. Most bedsteads were constructed of wood rather than iron, so bed bugs were a common nuisance. In some county homes, there was no separation of males and females, and no separation of the sane from the insane. Children intermingled with the adults. There was no treatment provided for the mentally ill at all. Yes, the comments by inspectors and others who visited the poorhouse in asylums in Nova Scotia. Beginning in 1915, the inspector, whose name was Dr. William H. Hattie, he had been the superintendent of the Nova Scotia Hospital at one time. He wrote the following: children spend day and night in the company of irritable and complaining old people, of mischievous and profane lunatics, and of driveling and unclean imbeciles. This is condemning these children to a life of uselessness and dependency. Now, that statement is really chilling to read because those children were in that environment, and you can't imagine how difficult it was. Now, in 1920, the Nova Scotia government hired a psychiatrist, Dr. Charles Clark from Toronto, to visit the poorhouses and asylums in Nova Scotia, which he did, and wrote a report, and that report is available at the Nova Scotia Archives. And he wrote in his report, the best of the county institutions visited are little more than prisons, conducted on humane lines. The whole county system stands condemned in the light of our modern knowledge of psychiatry. Then in 1944, Dr. George Davison, who was the Deputy Minister of Health for Canada, he wrote, the county homes are inadequately staffed. Many have serious fire hazards. There is a mixing of the legally sane and legally insane, and there is all too frequent lack of anything for them to do. So those were not very good indications of what was happening here. Now, based on what I just said and provided you with, you have an idea of the general consensus of inspectors and experts who visited poorhouses as to what they found and how they viewed the poorhouses and asylums. Now, I'd like to move to the one that, of course, is of most interest to you, and that's the one in your municipality, the Hants East Municipal Home for the Poor, South Maitland. You see a photograph of it there, and it was originally was the home of Squire McDougall, and it was purchased by the municipality, and they opened the poorhouse in 1895. By 1910, there were 23 paupers. I'd like to tell you quite a bit about it because it of course, turns out to be probably the best kept, best managed poorhouse in Nova Scotia. And you'll see why when I describe what the municipality did to try to create an environment for their poor and for their mentally ill. Now, to start with, I want to give you an idea of the number of people in the municipal home in East Hants. And so I plotted a graph here that covers the period 1895 when the home opened until 1956. And on the vertical axis is the ages of the people, and along the bottom are the various years, the teens, the 1920s, 1930s, right up to the 1990s. And I'm sorry, start again. Along the bottom are the ages of the individuals, and along the vertical axis are the number in those various ages. And you'll notice the blue line is for females, and the red line is for males. And you'll notice there's a completely different distribution of the lines, blue and red, for females and males. It turns out that the largest number of females were in the age range from the teens up to the 50s, whereas the largest number of males were from probably the 50s to the 90s. And one wonders why that would be the case. And I think the only suggestions I could make on that was that a large number of the young women who were in the municipal home were there, and we're going to find out how many, but later on. But they were there because they were pregnant, and at that time there was no place for them to go to have their baby other than to the poorhouse. And so we have a large number of young women in the poorhouse over that age range. With respect, later on, with respect to females, there are not many senior females in the poorhouse relative to the number of males. And I suppose that because a lot of senior women who, let's say, became widows, they would almost immediately marry. And when they married, of course, they married and wasn't necessary to go into a poorhouse because they now had another home. With respect to the men, in the period or the years from 50 to 90, those men who probably lost their wife early in, around 50, they sort of couldn't look after themselves, and they went to the poorhouse. So there's probably other explanations of why there's such a different distribution, but those are a couple that I thought of that probably have some merit. The number that were in the East Hants Asylum and Poor Farm, you'll notice that it varied dramatically. Up until 1920, it was around 20 per year. But soon after 1920, it started to climb, and it climbed and climbed and climbed up until 1947, when there were almost 85 in the poorhouse at one time. And then it started to decline again. And I'll explain why that happened, why it declined. But it does mean that the municipality had to look after a large number of people during the 1940s and 50s, particularly during that period. And so that gives you an idea. The total of 519 inmates in the poorhouse over the period. However, only 64% of the inmates in the East Hants Asylum Poor Farm were from East Hants, which may surprise you. It turns out that they were from other places. 36%, and I'll explain that in a minute. I also thought you'd be interested in the religion of the inmates, and of course, most of them were Presbyterian and United Church, but there were also a large number of Anglicans and a large number of Roman Catholics, fewer Baptists and fewer Methodists. A total of 85 children lived in the poorhouse. So over the period of from 1895 to 1956, the inspectors reported after they visited the East Hants Asylum Poor Farm. And here are some of the items they found. And I want you to compare what they found with what I had told you earlier about a lot of other poorhouses. When it opened, it had a water supply from a local spring, which the inspectors said was good quality water. They had an inside bathroom, which was amazing because practically no other poorhouse had an inside bathroom. They had a coal furnace. They had iron bedsteads. The only negative thing that he said was they didn't have any fire escapes. The next year he wrote, an addition is being built for the harmless insane. So in other words, they were able to separate the insane from the sane. Also, that inmates were bathed once per week. They now had fire ladders, which he didn't think was appropriate or adequate, because you can imagine the number of people that are in there that are bedridden. or blind or whatever, and fire ladders would not be very much help. Their diet and their beds and clothing were good, according to him, in 1896. 1898, he says, flush water toilets, closets, he called them, installed, which again is just unheard of as far as poorhouses are concerned, to have a flush water closet. Sexes are kept separate, religious services are held, fire ladders are still used. In 1899, he describes children attending the local school. Now, at most poorhouses, the children didn't go to school at all. There was no move to arrange for them to go to local schools. And in some cases, for instance, the one in West Hants, the local school would not accept the children from the poorhouse. So that they eventually did at the West Hants poorhouse hire a teacher, but for a while the children were not able to attend school. At East Hants, there was a separation of the sane from the insane. There was a complaint in his report that there's still no fire protection. That was said about practically all poorhouses. In 1913, they added 10 extra rooms. A fire escape was added, finally, in 1913. They actually got a telephone. A septic tank sewerage system was installed. That was a big move forward because of the situation. And in 1914, they replaced the oil lamps by using proper lighting, electrical lighting. No, I'm sorry, they were still using lighting, but very soon they're going to get electrical lighting. 1916, began to board Harmless and sane from West Hants. Yeah, West Hants made an agreement that they would pay so much to have their Harmless and sane looked after at East Hants. So during the period 1916 to 1956, a total of 34 patients were transferred from West Hants to East Hants, and of course West Hants paid East Hants for these people every year. 1921, they were boarding the poor and Harmless and sane from Richmond County due to a fire at the poorhouse at St. Peter's in Richmond County. Electric lights installed in 1922. During the 1940s and 50s, a large number, 53 of the paupers and Harmless and sane, were transferred to East Hants from Guysborough County residents who had been in the Antigonish poorhouse when it burned in 1947. Also, during the 1930s, a program of outside relief was provided to people in their homes in Rawdon, Mount Uniacke, Elmsdale, and 9 Mile River. Outside relief was mainly providing them with food, and you could see it covered quite a large area of Hants County. And as I said before, there were 85 children admitted during that period. The number of babies born in the poor farm was 13. So we come to the point of why were the county homes and asylums, including the East Hants Municipal Home, closed? Why were they closed? I should point out that sometime during the 1920s, it was decided that the word poorhouse wasn't quite the word that should be used for these places, so they started to call them county homes. And you'll notice before, the Halifax poorhouse became known as the city home. It just sounds better. So, why were they closed? Well, it turns out that a very, very famous Nova Scotian, who you probably have never heard of, because usually the famous Nova Scotians you don't hear of them necessarily, Dr. Clyde Marshall, was appointed the Inspector of Humane Institutions in 1955. He was very well educated. He was born in Nova Scotia, received his MD at Dalhousie, and then he went and trained to be a psychiatrist in Boston. he became Nova Scotia's first provincial psychiatrist. He visited all the county homes and asylums in Nova Scotia, and in his first report described them as follows. Such a hopeless intermingling of sane and insane patients, of adults and children, violates every principle of sound institutional management, mental hospital procedures, and social welfare practice that has been established in the last half century. He wasn't impressed. He immediately begins to prepare a report to the government recommending the closure of the county homes and asylums. He began by comparing the care and treatment of poor and mentally ill in Nova Scotia with that provided by other provinces for their poor and mentally ill. He discovered that whereas the municipalities in Nova Scotia were spending $1.45 per patient per day to care for their patients, the other provinces were spending an average of $3.65 per patient per day. Not quite 3 times, but possibly 2.5 times. And the thing that he discovered, which is quite unbelievable, the province of Nova Scotia was not contributing to the care and treatment of paupers and mentally ill patients in rural Nova Scotia at all. And he was appalled. So he went to see the Premier of Nova Scotia, Bob Stanfield, and they actually listened to him. Stanfield and Donahue was the Minister of Health. They actually listened to him, and within the year, they rescinded the Poor Relief Act, which had been around for 200 years, and replaced it with the Social Assistance Act. Dr. Marshall sent his report to Stanfield in 1958. The government passed the Social Assistance Act in May of 58, which replaced the poor districts in Nova Scotia with welfare districts. The provincial government had finally taken on responsibility for the care and treatment of paupers and mentally ill in rural Nova Scotia. Now, with respect to the East Hants, it, of course, was included in all of his reports, and he didn't comment on it specifically, but it was required to close too. And it eventually closed in December of 1971. So between 1947-48, when it had the maximum number within it of about 85 to 90, the number gradually dwindled down to the fact that around 1970-71, there were only 2 or 3 people or patients or inmates still within the East Hants Municipal Home. Now, one has to realize that what was happening was that when this act was passed, of course, people started to receive welfare checks. And those that were in the poorhouse or the asylum, particularly in the poorhouse, because those in the asylum, of course, eventually went to the Nova Scotia hospital. But those in the paupers who now were receiving a check every month, they could see it clear for them to actually move out of the poorhouse and possibly look after themselves. And that's what, of course, they did over a period of time. It didn't happen immediately, obviously, because there is a number of years between 1958 and 1971, particularly for East Hants. It turned out in my interviews with people who ran the poorhouses and some of them who lived there, some of them decided they didn't want to leave. They had lived there for years and years and years and years, and they enjoyed the food, they enjoyed the camaraderie, they just enjoyed the place, and they didn't want to leave, and they weren't forced to leave until the closure took place. And in the East Hants Municipal Home, that was in 1971. But until, as I say, at the end, there were only 2 or 3 people living there anyway, so it closed. So, sort of summarizing this, I think you who live in East Hants can be proud of the fact that your forebears, your parents and grandparents, probably your grandparents in most cases, or great grandparents, they really came forward and provided the residents of the county with the best facility that we could find in Nova Scotia. And I'm not saying that just because I'm here in your midst, but I say that because the records show that that was true, that was the case. And so I think I'll end my talk there, and I would welcome any questions you have that I can try to answer. So thank you very much.
So